welcome. My name is Sarah Grace Panserak, and this is an example of a full head-to-toe assessment for Nursing 612 Advanced Health Assessment through Maryville University. Hi.
Hi.
First you do is introduce yourself. Hi, my name is Sarah. I'm going to be doing a full head-to-toe assessment on you. Can you tell me your name and date of birth?
Sandra Renee Peterson, 7/27/93.
Good. As my patient walks in, I look at her gait and her balance, which are all normal. Then I offer her to empty her bladder and change into a gown. Do you have to use the bathroom? Okay, first things first, I'm going to inspect her face. Her face is symmetrical. Her head is normal cephalic. I'm going to also see if her inner campus is in line with the auricle of her ear on both sides, which it is. I'm going to then palpate her scalp. Her scalp is movable along the skull line. Her hair is thick. It's soft. I don't notice any dryness, and it doesn't fall out. I'm also going to now palpate her sinuses, her frontal sinus and her maxillary sinus. Any tenderness?
No.
The patient denies any tenderness or swelling, which is all normal. Can you puff out your cheeks and smile for me? Good. This is an example that cranial nerve 7 is intact. I'm going to palpate her TMJ. You open and close your mouth for me. Good. I'm going to have her close her eyes, and then I'm going to touch her with a cotton ball and see if she can feel when I touch her. This is testing for her cranial nerve 5.
Yes. 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 Yes.
And it was even on both sides?
Yes.
So this is an example that her cranial nerve 5 is intact. Next, I'm going to examine the patient's eyes. Looking at her eyes, I can see that they are symmetrical. There are no drainage or lesions noted. I don't see any ptosis or drooping. Her conjunctiva is pink and moist. Her sclera is white and no sign of jaundice. Her eyelashes and eyebrows are all normal. I'm going to palpate her lacrimal apparatus. Feels normal. Next, I would do a vision test on my patient. I would have her read this Snellen chart from 20 feet away and the Rosenbaum chart to test her near vision. And we found that her vision is 20/20 with corrective lenses. And this is demonstrating that the optic nerve, cranial nerve number 2, is intact. Next, I'm going to test the red light reflex in both eyes to make sure that they're normal with my ophthalmoscope. Look straight at me. Okay. Look straight at me. And both eyes, it is found to be normal. Next, I'm going to see if her pupils are reactive to light. I'm going to do this with direct light and constitutional light. Look straight at me. And both pupils react normally. Next, I'm going to test her vision, or check this for any extraocular movement with the 6-point gaze to make sure that there's no nystagmus noted. Can you look this way? Okay. Follow my finger. Good. No nystagmus noted. Cranial nerves 3, 4, and 6 are intact.